Bone cancer, the silent warning signs you can't ignore. Have you ever brushed off back pain or fatigue as just another part of your busy day? What if I told you these everyday annoyances could actually be silent warning signs of something far more serious, like bone cancer? While rare, bone cancer is incredibly dangerous because it often disguises itself as common aches and pains. That's why recognizing the early symptoms is crucial. It could save your life or the life of someone you love. In this video, we'll break it all down: what bone cancer symptoms look like, where it tends to spread first, and how long it can go unnoticed. Most importantly, I'll share what you should do if these signs start appearing. Stick around, this is more than just information, it could be a lifesaver. Unexplained weight loss and loss of appetite. When cancer develops in the body, it can throw your metabolism into overdrive, causing you to burn calories much faster than normal. That's why many people with cancer experience noticeable weight loss, even if they're eating the same amount as usual or even trying to eat more. At the same time, a loss of appetite often sneaks in. You might find yourself skipping meals, feeling full quickly, or simply losing interest in food, yes, even your favorites. So, what's going on here? Cancer triggers widespread inflammation and fatigue, which can mess with how your body processes food and energy. In later stages, this combination can lead to malnutrition, making you even weaker and more vulnerable. Of course, weight loss and appetite changes can be caused by a variety of health issues. But when they happen suddenly and without explanation, they're a red flag, especially when paired with fatigue or persistent pain. If you notice a significant drop in weight without trying, don't ignore it. Talk to a doctor to get to the root of the problem. The sooner you act, the better your chances of catching something serious early. Persistent bone pain. This isn't just soreness from a tough workout or a minor injury. We're talking about a deep, nagging pain that won't go away, even when you're resting or sleeping. At first, it may feel like a dull ache, easy to ignore. But over time, it intensifies, and no amount of stretching, rest, or over-the-counter painkillers seem to help. What makes this pain so tricky is that it's easy to dismiss. It's often mistaken for arthritis, growing pains, especially in younger people, or even an old injury flaring up. But here's the key difference: this pain lingers. It doesn't fade after a few days. It gets worse at night when your body is at rest. It doesn't respond to typical pain relief methods. So why does this happen? As a tumor grows inside the bone, it increases pressure and damages surrounding tissues, causing persistent pain that doesn't follow normal healing patterns. When should you see a doctor? If you've been experiencing bone pain for more than 2 weeks, or if it's getting worse for no clear reason, don't ignore it. Early detection is key, and a simple checkup with your doctor could make all the difference. Swelling near the bones. Another critical symptom is swelling near the bones. This isn't like the swelling you'd get from a sprained ankle or standing too long. Instead, it lingers, doesn't go away, and doesn't respond to typical remedies. It usually appears near joints, like the knees, hips, or shoulders, and can feel warm, tender, or even slightly red. What to look for? Swelling that persists for weeks. Skin around the area appears reddish or slightly discolored. Swelling that presses on nerves, causing numbness or tingling. So, what's going on? Tumors in the bone trigger inflammation and fluid buildup, causing persistent swelling. Unfortunately, many people dismiss this as a muscle strain or the result of overexertion. When should you see a doctor? If you notice swelling that doesn't go away or keeps getting worse, don't brush it off. Your body is trying to tell you something, and getting checked out could be the difference between early detection and late-stage complications. Where bone cancer spreads and how long it can go undetected. Bone cancer doesn't always stay in one place. It can spread, metastasize, to other parts of the body, most commonly the lungs or nearby bones. If it reaches the lungs, symptoms may include a persistent cough, shortness of breath, or chest discomfort. If it spreads to other bones, pain may intensify, and fractures can happen more easily due to weakened bone structure. One of the biggest challenges with bone cancer is that it can go undetected for a long time. Early symptoms, like mild pain, swelling, or fatigue, often resemble common issues like arthritis, injuries, or just getting older. Because of this, many people delay seeing a doctor, allowing the cancer to progress. That's why early testing is so important. Imaging tests like X-rays, MRIs, and CT scans can detect abnormalities, while a biopsy confirms the diagnosis. Catching bone cancer early makes a huge difference in treatment success and overall outcomes. If you're experiencing ongoing, unexplained symptoms, such as persistent pain, swelling, changes in mobility, or frequent infections, don't ignore them. Talk to a doctor and request further testing if needed. Early detection could save your life. Always listen to your body, it knows when something isn't right. Reduced mobility. Now let's talk about a symptom that can sneak up on you: reduced mobility. This isn't just a little stiffness after sitting too long. We're talking about a noticeable difficulty moving your joints or doing simple daily tasks, like walking, bending, or lifting groceries. What makes this symptom concerning? It gradually worsens over time. It often feels worse in the morning, like your joints are locked up. It's usually accompanied by pain or swelling, making movement even harder. Why does this happen? A tumor growing near a joint can interfere with movement, causing stiffness and limiting your range of motion. Many people assume it's just aging or overuse, but if there's no clear reason for it, you need to take it seriously. When should you see a doctor? If your mobility is decreasing for no obvious reason, don't just wait it out. Talk to your doctor. This could be an early warning sign of something much more serious. Unexplained bone fractures. This is one of the biggest red flags. Bones breaking with little to no force. Most of us associate fractures with falls, accidents, or sports injuries. But what if your bone suddenly breaks while doing something simple, like twisting, stepping off a curb, or lifting something light? This could be a fragility fracture, which happens when bone cancer weakens the bone, making it brittle and prone to breaking. Signs of a cancer-related fracture: fractures in unexpected places, like the pelvis, spine, or femur, a break that happens with minimal force, slow healing. Cancer-affected bones take longer to repair. When should you see a doctor? If you experience an unexplained fracture, don't just go through the standard treatment. Ask for imaging tests like X-rays or MRIs to determine the cause. Catching bone cancer early could make all the difference. Fatigue and weakness. Feeling tired is normal, but extreme, persistent exhaustion isn't. This kind of fatigue doesn't go away with rest and can make even simple tasks feel overwhelming. Bone cancer drains your body's energy, and if it affects bone marrow, it can cause anemia, further worsening fatigue. If you're constantly exhausted despite proper rest, don't ignore it, especially if you have other symptoms like pain or weight loss. Talk to a doctor for tests to uncover the cause. Visible lumps. Lumps near bones can feel hard or soft and often grow over time. At first, they may seem harmless, but as they enlarge, they can press on nerves, causing pain or numbness. If you notice a lump that's new, growing, or painful, don't wait, get an X-ray or MRI. Early detection improves treatment options. Night sweats and fever. Frequent, unexplained night sweats and low-grade fevers can be signs of an underlying issue, including bone cancer. The immune system's response to cancer causes inflammation, leading to these symptoms. If night sweats or fevers persist without a clear reason, track them and discuss them with a doctor. Numbness or tingling. If you frequently experience unexplained tingling or numbness, a tumor pressing on nerves could be the cause. This can lead to weakness, loss of sensation, or mobility issues. Occasional tingling is normal, but if it's persistent or worsening, seek medical advice and consider imaging tests. Chronic infections. Frequent infections or slow-healing wounds may indicate a weakened immune system due to bone cancer affecting bone marrow. If you're getting sick more often or taking longer to recover, especially alongside fatigue or weight loss, see a doctor. Blood tests can help determine if there's an issue with your immune function.